Mercury is one of the most toxic elements known to man. And the dental profession for a long time, and even today, there are many, many dentists in the United States that think there's nothing wrong with putting mercury amalgam fillings in the body. But the problem with mercury is it's a toxic heavy metal. Every time you have a cup of hot coffee or a hot drink, and you've got a mercury amalgam surface of that tooth in the mouth, it is creating or outgassing mercury.
There's a lot of evidence and there's a lot of information that relates certain parts of the mouth with different organs of the body, and that's what we can call meridians. So if I have a certain decay or an amalgam filling in a specific tooth, I might have an inflammatory response. It could be liver, intestine, or any other main organ, and probably I will not have any problems at this point, but eventually I can develop a disease.
My name is Alessandro Porcella, and I run a clinic in Tijuana for the last 10 years. The clinic is a dental clinic and it's a biological dental clinic. We are into the alternative part of the dentistry, which consists of using materials that are non-toxic. In the industry of the dentistry, it's thousands of materials that they do a lot of harm. And they're using like amalgam for the last 150 years. And we all know that amalgams are 50% mercury. The rest is nickel, copper, silver, and different materials. They use the mercury to amalgam to put together the other material. In the beginning it was against the law, but for some reason they allow it, and now they're still doing it up to today. It's very, very bad for the health of the general public.
Hi, my name's Ian Jacklin. I produced and directed a film called IQCancer.com. And while I was doing that, I learned that the mercury in our teeth is very, very toxic for our system. It's not good for you at all. And when I was interviewing a gentleman by the name of Burton Goldberg, who is known as the voice of alternative medicine, he mentioned that I could probably do a documentary just on biodentistry itself, and how the cancer is involved with it, what with the mercury in the fillings. The toxicity levels are just out of this world. So I decided to do that for my film, and while I was doing it, I met Alessandro, who was kind enough to invite me down to his clinic in Tijuana.
It can affect the brain, it can affect the lungs. And there's a whole dissertation about the adverse effects of mercury and how badly they affect these elements affect the health of a person, because they're grinding on the immune system all the time.
You can see in a lot of patients how their healing process is faster when you actually extract fillings or amalgam fillings, and if they're having any acute problem like arthritis or any digestive tract problems, you can also see a faster improvement of the symptoms when you help them.
There is a dentist who is praised by holistic dentists and condemned by conventional dentists by the name of Hal Huggins. He's the person that first exposed the dangers of mercury amalgam fillings to the general health of people. And you know, they will put mercury amalgam fillings in kids that are 3 and 4 and 5 years of age that have got cavities because of all the sugar and the sweets that they eat. And when you carry a mercury load for that number of years, it's bound to be deleterious to the body.
I learned that in Tijuana they're able to work much, much cheaper, and you're looking at 1/3 the cost. I also wanted to get, I had a lot of silver in my mouth. I ate a lot of candy when I was a kid, and I decided to get mine out, and an American estimate was $15,000 to get all the silver removed from my teeth and the biodentistry done to refill it. And it was $5,000, and Tijuana. So just, you know, mental note, you're looking at 1/3 the price in Mexico. And it's actually, the quality is just out of this world. They buy the best materials. The work is phenomenal.
We work in a very, very safe way under the sponsorship of Dr. Hal Huggins, which he is the one that give us the how you call the guidelines how to extract the amalgams without hurting people, because if you don't follow certain protocol, it's better not to take it out. It's better to leave it there.
What they'll do for you is they'll actually pick you up right at the border, so you don't have to bother driving at San Diego, take you into Tijuana, and if you're doing a lot of work and you need to spend the night, they put you up in a 5-star hotel. It's very beautiful. And they'll go ahead and they test they do blood tests, urine tests, hair tests, and one thing that's very special to this clinic is they do biofeedback tests, which is they hook you up with electrodes and they find out your energy, your electrical impulses and everything, and find out what materials would be least toxic for your system. So I thought that was very interesting. And when they're taking the silver out, they put in a dam so nothing can fall down your throat or you can't, you know, ingest anything. And they have a special ionizer. They got you on oxygen. They've got a vitamin C intravenous line going in you, so it's pumping up your immune system. It's carte blanche.
One of the things I do for the dental clinic is I test materials for compatibility with the patient. The materials that go into our mouth that replace mercury amalgam fillings or other materials that have been removed, we have to be sure that those materials don't, at some time in the future, have an adverse reaction to that patient in terms of a resonance or in terms of compatibility of materials. So I test those materials to make sure that the ones that are used are compatible with that particular patient.
The reason I came to Mexico is I'm very close to the border. I live in Bonita, California. My name's Mary Jo Geideck. And the reason I came down here is the dentists are excellent. The facilities are excellent. They're up to the state-of-the-art equipment. And what is so great is they're reasonable. They are a fraction of the cost they are in the United States, and yet you get a better quality of dentistry. I've been in the field of nutrition for 38 years, so I keep up with a lot of the foremost things, and they're finding about the heavy metals and all different things and how they affect your body. Quite honestly, lead, mercury are very toxic, and they are very toxic to your children, and they start working within the body. It can affect your heart and your liver and various other things. And such as when I came down here, I had a very bad one tooth that had an amalgam filling and a crown on it that was fractured. And I ended up having to have it removed. And as a result, it had already affected my bone, and I had to have a bone graft, which is unfortunate, but that was just because it was so decayed. However, because I practiced such good health, I didn't even know that it was that infected. And as a result, I had a form of diarrhea for 2 years that the doctors couldn't figure out, and the minute I had the tooth removed, it stopped. So that's how the effects of what is going on in your teeth can affect your body. If a simple tooth that you don't even know is affecting you, it's not aching or something, can affect you physically in other forms in your body. So meridians of your teeth connect to certain parts, and this tooth actually was on the meridian of my intestines and my stomach. So it more or less makes sense that that was causing me the problem.